Welcome to Neutralizing COVID, the monoclonal antibody story, the podcast where we unpack the science, strategy, and real world impact of monoclonal antibodies in the fight against COVID 19. I'm your host, Dr. Agrawal. Today's topic takes us into pharmacokinetics and bioengineering with pharmacokinetics and half life engineering in long acting monoclonal antibodies. Delighted to be joined once again by Dr. Aiswarya Chaudhuri, a nanomedicine researcher. It's good to have you back. Welcome to the show, Dr. Aiswarya.
Happy to be here again. It's always a lively and thoughtful conversation, Dr. Shikha.
Let's start with the basics. When we talk about pharmacokinetics in the context of antibodies, what exactly does that mean?
And pharmacokinetics refer to how a drug moves through the body, means how it's absorbed, distributed, metabolized, and even eliminated. For monoclonal antibodies, it's a bit different from small molecule drugs. Antibodies are large proteins, so they are typically injected or infused directly into the bloodstream. Once there, their pharmacokinetics are shaped by how long they circulate and how they are taken up by cells and how they're broken down by natural processes.
Well, in episode 6, we have talked about Evushell's long-acting antibodies and how their half-life was extended using Fc modifications. Could you quickly remind our listeners what makes an antibody long-acting and why that is so valuable in the COVID-19 setting?
Of course, as we discussed before, most monoclonal antibodies typically stay in the body for a few weeks. Long-acting antibodies, however, are engineered to stick around for several months. This reduces how often they need to be administered, making them specifically useful for prevention in people at high risk, like immunocompromised patients. The ability to offer protection for, say, 6 months with a single injection is a big clinical advantage.
And as a quick refresher, that extended lifespan comes from those Fc region tweaks you described earlier, right?
Exactly. In episode 6, we talked about the YTE modification, which enhances the antibody's interaction with the neonatal FC receptor or FcRn. This receptor helps recycle the antibodies back into the bloodstream instead of letting them degrade. That recycling mechanism slows down the clearance, extending the antibody's half-life. It's a clever strategy that how fairly standard in long-last acting antibody design, not just for COVID-19, but for other viral infections and even autoimmune diseases.
Perfect. Thanks for the quick recap and context. It's a fascinating how a single molecular tweak can have such a major therapeutic impact. Well, speaking of that, what determines how long these modified antibodies can last in the body?
The half-life depends on several factors, including the FC engineering, the dose, the individual's physiology. But with enhanced FC RN binding, antibodies can last anywhere from 2 to 4 times longer than their unmodified counterparts. Some can remain in circulation for 6 months or more. Another factor is how well the antibody avoids the degradation by enzymes or uptake by cells that remove proteins from the bloodstream. So it's not just one thing, it's a balance of structure, dose, and host biology.
Are there any trade-offs or limitations with half-life engineering?
There can be, while extending the half-life is generally beneficial, changes to the FC region can sometimes affect other properties of the antibody, like how to interact with the immune cells. That's why it's important that these modifications are carefully tested for safety and function. In some cases, longer lasting antibodies might also mean longer duration of side effects if they occur. Another consideration is that while they last longer, they can't be turned off quickly. So you need to be confident that they will remain effective against the virus over time.
That leads to an important point. What happens if the virus evolves, say, to a new variant, and the antibody is no longer a perfect match?
That's a challenge with all virus targeted therapies. If a variant significantly alters the part of the virus the antibody targets, the antibody might not bind as well or at all. Also, for long-acting monoclonal antibodies, this means there's a risk that someone could have circulating antibodies that don't neutralize the new variant. To manage this, developers are designing antibodies that target more conserved viral regions, the part that changes less over time. They are also working on antibody cocktails to reduce the chance that a single mutation will make the therapy ineffective.
Are long-acting antibodies only useful for prevention, or they also help in treating infections?
They can be used for both. In COVID-19, most long-acting antibodies can be explored as preventive tools for people who don't respond well to vaccines. But they have also been evaluated for treatment, particularly in the immunocompromised individuals. The idea is to provide a prolonged level of virus neutralizing antibody, whether to keep the virus out in the first place or to suppress it during the infection.
So, before we close, what's the future of this kind of engineering?
Half-life extension is becoming a core feature of next generation antibody therapies. Beyond COVID-19, you will see it in treatment for respiratory syncytial virus, HIV, and even chronic conditions. The technology is also being paired with other innovations like bispecific antibodies that bind the two targets at once. For COVID-19 and other infectious diseases, long-acting antibodies offer a promising strategy for durable protection, especially in people who may not respond to standard vaccines.
Thank you so much, Dr. Aiswarya. This was an insightful look into how scientists are engineering antibodies to stay ahead of the virus and stay in the body longer.
Glad I could be a part of this.
That wraps up today's episode of Neutralizing COVID, the monoclonal antibody story. Dear audience, we appreciate you listening all the way through. Subscribe for more and send this one to a friend if you think they would find it valuable. Until next time, take care and keep exploring science.